Hello and welcome back. In this video, we're going to be discussing the historical perspective of case management. So, modern day case management reflects many changes such as changing needs of individuals served, the financial constraints of the human services system, increasing number of people needing services, the outgrowing emphasis on client empowerment, evaluation of quality, and service coordination. So there's four perspectives that have shaped case management since the 1970s. Case management as a process, client involvement, the role of case managers, and utilization review, and cost benefit analysis. So the 1970s brought in deinstitutionalization of mental health, community, and changes in case manager practice. So the movement of large number of people from self-contained institutions to community-based settings, such as halfway houses, family homes, group homes, or single resident dwellings. So during these institutionalization period, case managers had to help determine which residents can live outside of the institution. So an early definition of case management came from the American Psychiatric Association ad hoc committee on the chronic mental patient. In summary, case managers help persons with disabilities access and use resources. Case managers play a key role in service integration. So the three elements, the three key elements of success in case management include responsibility for assessing the client's problems and developing responses to plan, continuity in planning and carrying and implementing the case plan, and accountability for tracking and updating the case plans, helping the client gain independence and incorporating the client's voice during the plan of care decision making. You keep seeing that we keep talking about clients gain independence. It's so important that we remember as case managers that the client has to build autonomy and they have to actually learn to actually do for themselves and have feed in on treatment. So those elements ensure that the client's problems is assessed, appropriate plans are put into place for the duration of treatment, and the client's ability to function independently. So case management provides a focus and oversees the delivery services in an orderly fashion. So during the 1980s, client involvement came to be emphasized more strongly. A new model of case management was proposed, giving clients a more active role in their development because, again, we want to help them build autonomy and become independent. So the role of case manager. Traditionally, terms such as case worker and case manager describe the efforts of helpers. Today, job titles include service coordinator, liaison worker, counselor, case coordinator, healthcare case manager, or care coordinator. The range of titles reflect the diversity of services that are delivered today. That come from a broader perspective, right? To emphasize the shifting the skills of managing someone's terminology reflected in more equitable relationship. So changes place the emphasis on working with other professionals, coordinating care and other services, and empowering individuals to use the system to help themselves. Again, that multidisciplinary team is so important, and case management plays an active role in that team. So for the client, the focus became the ability to develop skills needed to work within the human service network. For the case manager, the focus shifted to management to coordination. One result of spiraling cost was the spiraling cost of medical and mental health services is the growth of the managed care industry. Because again, as they start to manage care and pay attention to the cost about services and how much services people are delivered, it kind of changed the way services are provided. The purpose of managed care is to authorize the type of services and the length of time the care is provided. Case managers working with managed care are involved in utilization review and have the responsibility to authorize and deny services. Case managers are also responsible for cost benefit analysis, which focuses on the financial matters of a case, specifically the cost of the efficiency of services. So let's talk about the history of case management, right? First used in institutional settings, case management included the responsibility of intake, assessment of needs, and assignment of living spaces, right? So a pioneering institution. An early example of such was the institution of the Massachusetts School for Idiotic and Feeble-Minded Youth, which was established in 1848. The school provided services and case management such as tracking student progress, following provided up services, and managing information. Other practices at the school were aftercare and evaluation of services and advanced record keeping, contributed case management as we know it of today. Another example would be the Whole House, which Jane Addams funded the Whole House in Chicago, committed to sharing a love of learning. A service expanded the need for effective administration and record keeping increased, resulting in the collection of information about demographic participation and attendance. Advocacy was also integrated into the work of the Whole House. The Henry Street Settlement House and contributions to case management. So Lillian Wald and Mary Brewster established the Henry Street Settlement House in New York. They created a system for nursing in the sick in their own homes, promoting the dignity and independence of the patient. The work at the Henry Street led to two significant innovations: the designation of visiting nurse and the development of the Red Cross. Then we had the Mary Richmond and contributions to case management. So she was a social worker, a reformer who promoted the idea that each person was unique individual's personality, family, and environment should be respected. She believed that professionals should work with clients rather than doing things to them. So she is talked about social diagnosis developed by what was developed by her is that a systemic way for helping professionals to gather information and study client problems. Establish a series of methods for gathering information about clients, assessing their needs during treatment. She recognized that the gathering data is a complex process and urges the use of different methods. She also believed in multiple sources of information and warned that data gathering was often an incomplete process. So the impact of World War One and World War Two and Red Cross. So during the First World War, the American Red Cross, in response to increased interest in Mary Richmond's style of casework, used casework to address individuals' problems and their psychological needs. The Home Service Corps helped address the needs of families of military personnel. The Home Service Corps made two important contributions. They extended help was offered to individuals and their families, and volunteers became brokers of services, coordinating communication and requests between families and agencies. So contributions to case management from the Older Americans Act in 1965. The focus on providing services for older individuals in order to provide their quality of life. Contribute to case management by emphasizing the multiplicity of human needs and recognizing the needs to coordinate care. The Rehabilitation Act of 1973 also played a role to contribute to case management. This act and its the subsequent amendments emphasize client involvement and satisfaction, consumer choice, and control in setting goals and objectives. So the Children with Disability Education for All Handicapped Children Act of 1975 included an explicit case management process to treat the client and customer. The client was to be involved in identifying the problem, giving incomplete information about the results of the assessment of the needs, and empowering the help determine to the type of services delivered. So the Family Support Act of 1988, the Personal Risk Responsibility of Work Opportunity Act. This was mandated that case management be applied to the process of serving those who were deemed eligible for welfare. Case management became a key component in welfare to work programs by delivering the case plans and coordinating the services. Let's talk about the history of managed care. So the emergence of managed care has increased the demand for case management services and provided a new model of service delivery. We talked about fee for services and early provision of medical care. Each patient was assessed a fee for each health or mental health service provided by the professional. In the 1930s, physicians implemented prepaid group plans or managed plans for medical services. The basic concept of prepaid plan was to guarantee a defined set of services for a negotiated fee. And managed care is now commonly regarded as being connected to the rising costs and decreasing quality of health care and mental health care. So when we define managed care, this is an organized structure that uses prepayment rather than fee-for-service payment. It can be designate the array of different payment plans, such as prepayment or negotiated discounts, and policies restrict access to providers such as physicians and other health professionals. So pharmacy benefits management. So focuses on controlling prescription costs through negotiation, use of generic treatments and mail delivery for prescriptions. HMOs, health maintenance organizations, a generic term for covering a wide range of organizational structures, combining delivery of and financing onto the system. HMOs provide healthcare and ensure healthcare delivery in the geographic area, have agreed upon a set of health maintenance and treatment services and involve a group of voluntary enrollees. A preferred provider organization, a PPO, plans that fall between the traditional HMO and the standard amenity health insurance plan. They've established contracts with designated medical providers. The clients receive better benefits when care is received from a preferred provider. A point of service or POS allows for more flexibility with the HMO and PPO plans provided, and coverage is reduced for out of plan providers, and clients pay higher premiums, deductibles, and pay a higher percentage of medical fees. So health savings accounts. These are high deductible and lower premium healthcare plans that were developed in 2003. So employees make tax-free contributions up to $2,500. Employees decide what qualified service they want to purchase, and unspent funds in the plan are rolled over to the next year. We also have health reimbursement arrangements similar to health savings accounts without a cap of the employee contributions. They also have plans offered under health care exchanges. These plans are mandated by the Affordable Care Act. And we get this managed care has emerged as a response to the fact that employers, government payers, and clients or providers are all seeking ways of containing healthcare costs. Managed care plans emphasize management and medical cases review and control utilization. So there are clear advantages and disadvantages of the plans that have emerged. Case managers play a critical role in the management of care. Organizations have developed to establish standards for case management in these settings, such as the Case Management Society of America. In response to professionals and client frustrations, several advocacy efforts have been involved. Case management plays a huge role in managed care because, again, all the services that we're referring out to for clients or whatnot can all be give the client a way of providing information and feedback on the sources that they need or whatnot to make sure that they're getting services they need or not getting, and they have medical necessity to actually receive those services and can actually afford those services as they go through their plans. So professionalism, professionalization of case management and expanding responsibilities. So within human service delivery includes a national certification offered by several professional organizations and states. So human service board certified practitioners requires demonstrated competence in case management, professional practice, and ethics. So again, most case managers have to get certified and have to go through certain trainings to actually obtain their certifications, and they must renew those and get trainings every year to make sure that they're able to provide those services, and they're taught to provide services in specific areas. So the National Association of Social Workers offers a credential for case managers with a bachelor's or social work degree. As the care environment continues to shift, the case manager's responsibility and accountability through certification will increase. So case management has come a long way, and it plays a huge role in multidisciplinary teams. Case management is very, very important, and you can see that some clients can't really focus in on certain treatment needs, especially with mental health and clinical counseling, because a lot of times their basic needs aren't met, and they're worried about having resources and um, having the proper resources to actually live proper lifestyles and whatnot, so they can focus on further treatment and focus on other issues and able to actually get jobs and provide for their families and get food and actually have their health, their medical needs met. Case management plays a huge role to help clients become more independent in obtaining those services.